Good afternoon, and thanks for joining us for Living Local, your lifestyle show for all things Charleston and beyond. I'm ASHLEIGH, MESSERVY. It's Medical Monday here at East Cooper Medical Center, and today we're sitting down with a gastroenterologist to discuss the signs, symptoms, and treatment options for those suffering from irritable bowel syndrome.
Medical Monday, sponsored by East Cooper Medical Center.
Joining us today, we have Dr. Raya Kaplan. She's a gastroenterologist here at East Cooper Medical Center. Thanks for being here.
Thank you for having me.
All right, so we're going to talk about IBS, or Irritable Bowel Syndrome. What is it?
IBS, or Irritable Bowel Syndrome, is a condition where people experience abdominal pain or discomfort, typically maybe bloating, cramping associated with a change in the frequency of bowel movement, change in the form or consistency of the bowel movement, and also relief after having a bowel movement. So those, what I went through just now, are sort of the what we call the Rome criteria for how we diagnose IBS, but typically patients will come in complaining of pain, bloating, cramping, diarrhea, constipation, and then there's a subset of IBS that patients have both diarrhea and constipation.
Oh wow, that sounds like a nightmare. So as far as like how long should they wait if they're starting to feel like their stomach's just not right? How long do you think, I mean, I know you can't give us like a set time, but how long before they should probably come and see somebody?
Yeah, I mean, if you're having diarrhea that's, you know, new in onset, I mean, if you have diarrhea once in a blue moon, you know, with certain foods, but if you're getting diarrhea or, you know, most days out of the week, or having constipation most days out of the week, pain or bloating that's more days out of the week, that type of thing.
So what are some of the causes? Is it food related and things like that? Could you have like an allergy that you didn't know about?
Right, yeah, the definite cause is not known. There's some theories that, you know, IBS patients have different levels of contractility of the intestines. So patients with constipation, the intestines may not contract as much or as strong, so there's bowel movements don't come as frequently. Patients with IBS with diarrhea tend to have more spastic colons, so they get a lot more urgency, cramping, diarrhea. There's also another theory about what's called visceral hypersensitivity, where patients with irritable bowel syndrome actually feel normal levels of gas, normal amounts of stool, more than the average person without IBS.
Oh, wow.
There's some thought that there could be association with infections, like gastrointestinal infections. That's called post-infectious IBS. And then there's also a thought where the normal bacterial flora in the GI system are somewhat different or off in patients with IBS, and that could contribute.
Is that where like probiotics and stuff like that?
So that's where some of the research and studies have gone on with probiotics. There's other, you know, not necessarily cause and effect, but there's certainly IBS more in women, younger age. It's not caused by stress or depression or anxiety, but certainly the symptoms can be exacerbated by those things. So there's no specific cause known, but there's definitely some associations and things to look out for.
Because I've found that I've had some friends who go in and they think that they have IBS, and then they find out they have celiac disease and stuff like that. It can actually open Pandora's box, right? To find a bunch of other things you didn't know were going on.
Right, so kind of the tricky thing with IBS is that it can mimic a lot of other diseases, or other diseases can mimic irritable bowel syndrome. So, you know, IBS itself is diagnosed based on symptoms, the criteria like I mentioned, and ruling out other diseases.
Gotcha.
So like you said, celiac can cause bloating, can cause diarrhea, you know, early onset colitis where you don't have blood in your stool yet, but you have pain, a bit of diarrhea. All those things can present similar to IBS, so it's important to not only be diagnosed based on symptoms, but rule out other diseases.
Gotcha. And as far as treatment goes, do you incorporate a lot of different approaches, some of them being dietary, some of them being medicine and things like that?
Right, so there's various approaches, certain things lifestyle-wise, trying to minimize stress and anxiety, easier said than done. Things like avoiding certain food triggers, everyone is different. I'll often recommend like a food diary and see if there's certain foods that seem to trigger the symptoms. There's also something called the FODMAP diet, which, you know, FODMAPs are short-chain carbohydrates that don't get digested by the small intestine. When they get to the colon, they get fermented, cause more gas, bloating. So there's certain foods, a long laundry list. There's certain foods we, you know, sometimes recommend at the recommendation of your doctor. It's not something I would recommend doing just on your own. You need guidance from a doctor on that. So those are some of the lifestyle things. There are medications. There's not one, I wish I could say there's one medicine that just treats IBS, but there's various medications that can treat the symptoms. For the spasming, there's medicines that called antispasmodics that help relax your intestines so you don't have as much spasming and urgency. If you have IBS with diarrhea, there's over-the-counter medications. There's also prescription medication if the over-the-counter doesn't work. For IBS with constipation, again, there's over-the-counter things like stool softeners, Miralax, to name.
But you don't want to get to the point where you're just doing those all the time either, right?
Right, and then, so there's also prescription medications for IBS with constipation as well. So,
So the safe way to play it is just come see you, right?
correct.
I love it. All right, well, thank you so much for being here. And for more information, head online to eastcoopermedctr.com.